When you go for a massage, what type of massage are you asking for? Is it deep tissue? I'm here today to talk to you about why deep tissue may not be as effective as you think, and why it may be harmful, and what your body and you may benefit from instead. Hi, my name is Kathy from Kathleen's Natural Balance. I'm an intuitive massage therapist, a physical therapist, and a Reiki master. So deep tissue massage is not for everyone, especially if you have certain medical conditions. There are certain reasons to avoid a deep tissue massage. One of the big ones is if you're on the brittle bone, severe osteoporotic side of things, deep tissue work will not be beneficial and could be harmful for you, and it could break a bone. If you bruise easily, if you have thin skin, if you're frail, or on the elderly side, you don't want the deep tissue work. It could be harmful for you as well. There are other medical conditions, and always check with your physician before getting a massage. Blood clots, things like that. I'm not going to get into all of them. So deep tissue, people think that deep tissue is effective. Deep tissue can be very effective. However, people don't realize that you can get an effective massage without it being a deep tissue massage. When I work with people, I do specific deep work. I don't do full body deep work, not often, because people benefit more when the pressure is a little bit less. They can actually relax with the massage. Their muscles can relax. The deep work, people tend to tense up, and you can't get those muscles to relax. So deep work is not always what your body needs. However, you can still get a firm massage. So this is where the language comes in with your massage therapist. You want firm work, and maybe you want some deep work on the knots here or the knots somewhere else in your body. That's not deep tissue, a full body deep tissue massage. That's a massage with some deep work. That is what I do with my clients. If someone has areas of tension that I feel, I'll work deep in there, and I have communication with the client because I don't want to hurt anyone. Massage should not be painful. That's what I learned, and that is how I practice. It may be uncomfortable because I'm working a knot, and it has to be within the parameters of the client. So it's a communication. So the takeaway here today is deep tissue is not always effective. You can have a safe, effective massage